need to start doing some interventions that are going to help people to manage their psychological responses to health and wellness and illness. For me, a particular intervention I've developed over the years has to deal with grief. We all suffer grief at some point in our lives, some of us more than others, or for more concentrated times where we have a death or two deaths in a family or a friendship group. And what I've learned over the years is that most of us aren't comfortable with grief, and so we don't know how to intervene. And so we, even as nurses, avoid talking about grief for fear that we're going to make someone cry. What I learned over the course of my scholarship over the years is that addressing grief is a very healthy thing to do. That it's how we actually heal from the pain of a loss and move on. And so part of the wellness movement has been addressing things as simple as grief and loss in someone's life, helping them to develop interventions that are practical across a wide variety of settings. So the intervention I developed is particularly for healthcare workers who have been exposed to a lot of morbidity and mortality in the workplace. This intervention was developed around a framework of counseling to reduce symptoms. So why would we want to reduce symptoms of grief? Well, when people are grieving, we know by the research that they have more accidents. They fall down the stairs more. They have more car accidents while they're grieving. Older people are more likely to die in a shorter period of time if they've just suffered a major loss in their life. So there are reasons why we want to help them with their sleeplessness, help them with the problems eating that come along with grieving. Isolation from other people. Because they're grieving, they tend to isolate themselves psychologically. So the intervention helps the healthcare workers to recognize the normality of these symptoms, that it's normal to be grieving. It's painful, but it's normal. But also to show them that it's a process, that you can get through grief. Recognize it is a process, recognize that you will feel better over time, but the intervention involves sharing your story with someone else, being reflective on what did that loss mean to you, and how do you pick up the pieces and go on with your life now, and not have that person in your life.